Hi, I'm Dr. Arviv at Arviv Medical Aesthetics, and I'm here to talk to you guys today about the aging face and aging skin. So I brought this beautiful young lady here, and she is, how old are you? Would you like to share with us?
I'm 38.
38. So she's looking great. She's aging very beautiful. She has very nice skin. You can, usually we'll assess for signs of aging. So one of the signs of aging is going to be sun damage. So one thing we can look at a patient and kind of talk about, well, how much pigmentation do they have? Is there sun damage and or vascular lesions that we can treat? So in her case, you can see just a little bit of sun damage. There's not much. Not so much on this side, I guess mostly on the driver's side here, we get a little bit of pigmentation, and she's wearing some makeup, so you probably don't see it 100%. The other thing that, patients are always concerned about is wrinkles. So we're all, when you're young, you're nice and smooth. And as we make those facial expressions, like in her case, she's giving us this big smile, giving us a little surprised look, lifting the brows. Those dynamic movements start to create some fine lines in the skin. And you can see some around the eyes. So if you don't do things to prevent that from too much movement, such as neurotoxins, then you can start to see more static lines. So you start to see these etched lines in the skin that just become more permanent, and they're there even when we're not making facial expressions. So those are some things that we can treat. Of course, there's other things that you don't necessarily see, or you can see and maybe the patient complains about what they feel, which is pores and oil. So there are patients who have a lot of oil production that might have to suppress that, or they have large pores and it changes the texture of their face. Patients with acne scars that we have to treat texture. So in her case, she doesn't have to worry about any of that. One other thing that I think a lot of people look at when they're thinking about beauty is ratios and proportions in the face. And so in her case, like the ratio, she has beautiful large eyes and nice thick eyebrows, but then her lips are a little bit on the smaller side, so she has a little bit of bigger nose proportionally, but then to her lips, she could potentially enhance a little bit of the lip size in order to create a better ratio. That doesn't mean that's something that she has to do. It's just really, at the end of the day, how you feel about your face and if you want to improve those proportions. There's different proportions that we sometimes look at in terms of cheek volume, if there's volume loss, which in her case, she has just the beginning stages of some volume loss in the tear troughs here. And what I do is I do a little push here. You see how there's a nicer transition between the lower lid and the cheek. You don't want to have this dip that's just fat, a little bit of volume loss. So she can do a little correction there. Not much here in the nasolabial folds, but she could also potentially do, she could do a little bit of lip enhancement, maybe a little bit of chin enhancement if she wanted to. As far as skin elasticity, she has pretty good elasticity. Things kind of just bounce right back. And so as we age, the elasticity tends to be reduced, and the skin begins to sag. And we don't see that here, but she may have a tiny bit of volume loss in the cheek. And a lot of times you start to lose volume here, which you can see directly correlates to the beginning of the jowls. So as we lift this up here and add that volume back, the jowls will lift, and that will create a better contour in her jawline. So thank you very much for allowing us to use your face to talk about these things. There's a lot of things we can offer in terms of pigmentation, wrinkles, texture, and so forth, and volumizing. But what I'm going to do now is going to bring our other lovely patient, and we can talk about now the progression of just the progression of aging and what additional changes are happening here between, you know, late 30s, early 40s, somebody like me, to someone who's maybe in their 50s or 60s. We'll be right back.